Hi dental fans, I'm Dr. Rich, and today I'm going to talk about a dental implant bridge and show you what it looks like. Please subscribe and click the like button. It'll help me out. So this is a case I'm currently working on, which I just got back from the lab. The patient will be coming in the next week or two to have it fit. Now this particular patient was missing some teeth in the upper right as well as in their upper left and lower left. At first, they just wanted to replace the missing teeth in the upper right. So my first step was to take molds of their teeth and wax up the replacement teeth. I saw I could fit 3 teeth in the space. From this wax up, I had a surgical stent made to guide where I placed the implants. I decided on 2 implants with a 3-tooth bridge on top. I used Bicon short implants that are about a 1/4 inch long. That's 6 millimeters. After the first implant placement visit, the patient decided to have 2 more implants placed on the left so they would have more teeth to chew with. Once the implants healed, I uncovered them and took new molds. This is the result of the new molds. The models are made out of dental plaster with replicas of the dental implants embedded in the plaster. This pink rubber is fake gum tissue. I removed a piece of fake gum tissue from the lower jaw model so that you could see the implant replica underneath. The single teeth are what's called integrated abutment crowns. That means they are one-piece crowns and posts. There is no cement used and the entire piece is press fit into the implant. I usually have the patient bite down on a cotton roll to seat the crown fully. The crown part is made of a polyceramic material which is durable as well as repairable in case it ever chips. The post part is made out of titanium. The bridge is a different design. It has 2 custom designed posts made out of titanium which fit into the implants. The lab sent me a handy fitting jig to make sure the posts go in correctly. Once I fit the posts into the implants, I'll then fit this all ceramic bridge. The bridge is made out of a very strong ceramic called zirconia. I will then cement the bridge onto the post with dental cement. As soon as the cement sets, the patient can eat right away with their new teeth. So tell me, do you have implants? How was your experience with them? Are you happy you had dental implants? Please leave me a comment below. Thank you very much for watching. See you in the next video. And make sure you brush and floss every day.